This is the case of a 35-year-old seropositive female with early onset of very aggressive rheumatoid arthritis with a strong family history of autoimmune disease, with rheumatoid arthritis diagnosed in both her mother and grandmother. This patient was initially seen by her rheumatologist, who noted very active swollen and tender joints, 1 hour of morning stiffness, and a normal CRP and SED rate. The patient's initial Vectra result came back at 65, indicating a high inflammation as measured by the Vectra score. This patient was treated with a rapid titration of weekly methotrexate, low-dose prednisone, and after 3.5 months of conventional oral disease-modifying therapy, a biologic drug was added because of continued active disease despite therapy with conventional drugs. The clinician saw the patient after 2 months after the biologic was started and noted a significant improvement in her clinical exam, less morning stiffness, and a significant improvement in swollen and tender joints. Her subsequent Vectra value, which was obtained at that office visit, showed a very significant reduction from high 60s to mid 30s, indicating a shift from high molecular activity to moderate molecular activity after successful therapy with the biologic and methotrexate therapy. This change far exceeded the minimally clinically important difference of 8 points and revealed a very significant reduction in inflammation as measured by the Vectra test. The patient was seen at another 3-month interval and continued to show improvement with very little in the way of residual joint tenderness and inflammation, and her longitudinal Vectra score showed a value of 28, indicating further reduction in her inflammation as measured by the Vectra test, and also indicating that her risk of radiographic progression and irreversible joint damage was markedly reduced as her Vectra score was markedly reduced over time with effective therapy.